So I'm Jane Howard, excuse me, and I'm the Programme Manager here at the National Centre for Creative Health. And I'm joined by our General Manager, Alexis, who's set up the session today and will be supporting me with the tech and gathering your questions, and also does a sterling job in pulling all the information together afterwards. We're in webinar mode, which means that you will be muted, although, and we can unmute you if necessary, but last time we did the questions, it was really helpful for Alexis to gather questions at the end because there were a number that were quite similar. So we'll probably be doing that again at the end. And we are recording the session. So although the majority of this session is really a presentation, be aware that there might be those little boxes down the side with your down the side of the screen. So yeah, just be aware that your initials will still be visible. I think that's it in terms of the tech, etc. So yeah, welcome to the session. I'm going to run through a presentation which will give you an overview of the programme and what we're looking for. Details of the application process, and then there should be time for questions towards the end. Please put your questions in the Q&A as we go along too. If we don't have time to answer all the questions today, we'll follow them up, and we will be posting all responses on our webpage so that others can see them. So we did have a 20-odd questions from the last session, which we put into an FAQ paper that's now on the website. And if we get new questions today, we'll be adding to that. So very briefly, in case we have people on here who aren't familiar with the National Centre for Creative Health, the NCCH, and our work, I'll begin with a little bit of background. I'm just going to start sharing my slides. I forgot to do that. Here we go. So just a little bit about NCCH. NCCH was formally launched in March 2021 with a mission to advance good practice and research, to inform policy and promote collaboration, helping to foster the conditions for creative health to be integral to health and social care and wider systems. So this programme, which is about creative health leads in systems, is a really important aspect of that mission. We define creative health as creative approaches and activities which have benefits for our health and well-being. Activities can include visual and performing arts, crafts, film, literature, cooking, and creative activities in nature, such as gardening. And creative health approaches may involve creative and innovative ways to approach health and care services, looking at things like co-production, education, service redesign, workforce development. And creative health can be applied in homes, communities, cultural institutions, heritage sites, healthcare settings, or anywhere really. And we believe creative health contributes, well, we know it contributes to the prevention of ill health, to the promotion of healthy behaviours, to the management of long-term conditions and treatment and recovery across the life course. So we take a very broad view of creative health, which means that there's something in there for everybody. And some of you will be here today, will be coming with different priorities and different things that you're interested in, but we believe that creative health can impact on all of those priorities. You can find out more about NCCH and our relationship with creative health on our website. So this programme, the Creative Health Leads in Systems programme, the purpose of this programme is to really integrate and embed creative health into key NHS and broader health priorities. So it's about public and population health. It's about looking for opportunities for creative health in clinical and care pathways, and also about how creative health integrates into the development of a neighbourhood health service. And we see creative health as playing a key role in the 3 key shifts in the 10-year plan for the NHS. That is treatment to prevention, the hospital to community shift, and analogue to digital, as well as contributing to the overall system change and transformation. What we want to see as a result of this programme is an increase in creative health activity in health and care systems, which will contribute to a more person and community-centred service and reduce pressure on the system. That's the long-term sort of aim of this programme. Some key points just to run through with you. It is supported by the Arts Council England and the Bearing Foundation, and initial funding for this first round is provided by Arts Council England. It builds on the learning from our Creative Health Associates programme, which ran from July 2023 to March 2025, in which we had 7 Creative Health Associates, 1 in each NHS England region, and they were hosted by integrated care boards. That programme really identified where the opportunities might exist to embed and integrate creative health. It catalysed new networks and partnerships between the health and care and the creative and cultural sector. And it demonstrated the potential for such roles to really contribute to wider system transformation. So it was a learning exercise for us. We got a lot from that programme, and the Creative Health Leads in Systems programme has emerged from that phase. We anticipate that this programme will run over the next 3.5 years, so completing in 2029, and that there will be a rolling programme of opportunities for systems to apply to be part of the programme. I can say a little bit more about that later. It is a health and care system facing programme with a focus on supporting the 10-year plan for the NHS in England, and that includes addressing health inequalities. But it's important to recognise it is about making change within the health and care system. So the key points again, the programme offers a salary subsidy for a creative health lead role. I'll give some more detail on that in a moment, but it's roughly 50% subsidy in year 1 and 30% in year 2, but I'll explain how we've come to that in a moment. We anticipate 25 to 30 posts becoming available over the next 3 years, with the final round of posts probably being agreed in sort of summer 2027. We'll be funding 5 posts in this first round, a closing date for which is end of January, and we'll be announcing further numbers as the funding becomes available. There's going to be a structured development programme for the creative health leads and also for others working in the system. And again, I'll say more about that shortly. A key difference from this programme to that of the Associates programme is that these roles will be employed within health and care systems. Again, I'll say more about that in a moment, as there are various options for how that might work, but it is about having these roles embedded within the system. So let's take a look first at the money. The programme, as I've said, provides a salary subsidy of approximately 50% for the first year and 30% for the second year of the programme. And we've based this on roles being 4 days a week, 0.8 whole-time equivalent, and at a salary that is at the entry point level of an NHS Band 7 or the equivalent in another organisation, plus on costs. And we've factored in a 3% cost of living increase in each year. The Band 7 recommendation has really again come out of our learning from the Associates programme. There is something around a Band 7 that has access to a wider range of people with influence in the system than a lower post, and it's also really indicative of the fact that we see these roles as strategic roles. So that's how we've costed the subsidy, which means that we provide 12 months support of £25,000 and a further 12 months of £15,000. So total support of £40,000 over the 2 years. So the match funding requirement is therefore £25,000 in the first year and £35,000 in the second year. So a total of £60,000 over 2 years. So the split that you're getting over the 2 years is 60-40, 60% of the funding for the salary being provided by the system and 40% provided through the funding that we've got through NCCH, through the Arts Council. We're not wedded to particular financial years, so it will be for organisations to work out how best to manage this and to discuss sort of options with us. So we're not stuck with particular financial years that have to start in April and finish at the end of March, for example. It could run over more than 2 financial years, but there needs to be a commitment to a 2-year post. We recognise that that's challenging at the moment, but we think 2 years is the minimum that we need in order to see these posts have an impact. And the other really important issue is that match funding cannot come from arts funding or culture budgets. The funding that is being provided is already from arts and culture budgets, and it's aimed at leveraging in funding from the health and care sector. So that's a really important point. It can't come from your arts and culture budgets. But the match funding can come from a number of different sources, and we've already had conversations with systems about match funding being provided by 4, 5 or 6 organisations. That could be local authority, public health, NHS trusts, integrated care boards, and others. And that's what we're anticipating. Obviously, if one organisation is able to fund the whole match, that's fine too. But what we're finding is that, that there's a number of reasons why a number of partners are coming together. Firstly, the post is working across the system. So that gets buy-in from all the partners in the system. But secondly, it means that the match funding requirement for each organisation is less. So if you've got 4, 5 or 6 partners in there, the amount of funding that they're being asked to find for this, it is not so substantial and is a lot more achievable. So our expectation is, from the conversations we've had so far, that we'll be seeing pooled funding coming in to provide the match funding. I'm just going to say a little bit more about the development programme for the Creative Health Lead post holders. Excuse me. The purpose of that programme is, as it says here, to provide a space for creative health leads to exchange knowledge, discuss challenges and opportunities, and build their leadership skills. So whilst we expect the creative health leads to be integrated into their local teams, we also know that these roles may be quite different to many others in their organisations, and that they might be working in contexts where they could feel quite alone or quite challenged in terms of what they're trying to achieve. We know that the Creative Health Associates valued that opportunity to share their learning, challenges, their opportunities and their skills, and so we want to build on that with this programme. The programme will be co-designed with the creative health leads as they come into post, but we have drafted out a programme as a starting point. It feels that we should have an initial outline as they take up these new roles. And we've designed the programme, well, the programme will be designed so it's got sufficient flexibility to respond to the programme as it evolves. So that as more creative health leads come into play, the programme may develop into, for example, regional learning networks or thematic groupings for the larger group. Managing a sort of a cohort of 30 people, for example, in one learning programme is quite challenging. So we'll see how that moves, but we're anticipating that flexibility. And we're expecting that the creative health leads will come with a wide range of different experiences, skills and knowledge. So we anticipate that peer-to-peer learning will be a really important element of the programme. We want people to learn from each other's experiences and knowledge. So the outline programme, we will be looking at some intensive learning sessions over an initial 4-week period when someone starts in role, which will include the purpose of the programme, what is it trying to achieve, understanding the health and social care landscape nationally, and then how that relates to the geography in which they're working. Understanding the creative health landscape. So again, we anticipate there may be people coming with a really good knowledge of the creative health sector, but less of the health and care sector, and vice versa. People coming maybe from a health or public health background who have that understanding, but need a little bit more familiarity with the creative health sector. We'll be looking at equity, diversity and inclusion, an update on the latest evidence and research, and a focus on health inequalities and population health. So these intensive learning sessions would be repeated over the lifetime of the programme as new roles are established. And we might expect to have, at least 3 4-week blocks in the first year of the programme, probably up to about 6 hours in total over that 4 weeks. And then we're looking at 6 weekly online peer support and learning sessions, which will include a whole range of different topics and bring in invited speakers. So we'll be giving an introduction to systems thinking. A lot of the evaluation from the Creative Health Associates programme took a systems thinking approach, and we're keen to develop that with creative health leads to enable them to think about how they are impacting on the wider system. It might include topics such as using health and other data, looking at where the sources are for that, how they access it, who can help with analysis. We'll be providing updates on developments within health and social care. As we know, it's a rapidly changing field, so we expect to be, to be updating as we move along with what's changing in the system, what's becoming a priority. We'll be looking at mechanisms for health and social care integration and collaboration, including pooled funding. And related to that, we'll be looking at commissioning and funding models, as well as thinking about things like provider consortia or provider sort of alliances. We'll want to look at impact measurement. That'll be something fairly early on. We'll be working with our external evaluators so that they can develop sort of tools and enable creative health leaders to capture the data that they need to from the outset to demonstrate their impact. And again, we recognise that people will be working in different geographies and different priorities, so we can't have an evaluation that is sort of just one size fits all, but we're trying to provide some common tools that people can use. And we'll be looking at how we bring lived experience into the work, sharing skills and knowledge among team members, as I said, and developing a framework for the creative health within systems. And then in between those sessions, in between those 6 weekly sessions, we'll have other 6 weekly optional online drop-in support and development sessions, which will be facilitated by me as the programme manager, and will apply principles from action learning and human learning systems. So it'll be that type of model, but we won't be necessarily running an action learning set as such, but we'll be using those principles. And we anticipate really close working with colleagues in the Culture, Health and Wellbeing Alliance, London Arts and Health, the Metro Mayor's Creative Health Network and the National Arts in Hospitals Network to ensure that the community of practice is inclusive and that everybody benefits from the collective knowledge, expertise and perspective of the wider sector. So we've already started conversations about how that might work, and we'll want to see that develop. And then we'll also be working with people within the wider system on a development programme to help embed creative health in the system. So we anticipate this will involve workshops on particular topics. It will involve testing out tools and approaches and sharing learning about models of effective working. And again, we'd want this to respond to the needs of systems, but we'll be putting an initial programme together with the support of, we have got a small advisory group that are coming together for this programme that will help us with that. So what about the roles then? Well, we expect these roles to be bespoke to each system and responding to the sort of local context and local priorities. We have drafted a core job description which can be adapted for local context, and that is in the information pack, and you can find all this information, including the information pack and application form, on our website on the Creative Health Leads programme page. But we thought it would be helpful to draft that core job description, but it is there as a basis and will be, say, adapted for local contexts. We're also not being prescriptive about where posts are based. When we first began discussing this programme, which is, I don't know, 18 months or so ago now, we were talking about them being in integrated care boards. But since then, obviously, we've had this big restructuring of the NHS, the development of the neighbourhood health service model. And, still the future for ICBs and what their role is still to be defined. So we've gone for a much more flexible approach. So the creative health lead role could be in an ICB, excuse me, but it could also be in an NHS provider organisation. We're hearing about advanced foundation trusts and integrated health organisations where providers take on additional responsibilities for the healthcare of the wider population. They might be appropriate places to host these roles. Where we're seeing a lot of interest is in the development of the neighbourhood NHS, which provides sort of further opportunities. So a role might sit in a neighbourhood or across a number of neighbourhood teams, for example, and we expect to see applications that are suggesting that. The role might also sit in a local health public health team. And there are other organisations also across the wider voluntary community, faith and social enterprise sector who have formal partnerships and relationships and contracts with the NHS and where it might be appropriate. So, for example, we know of places where they have system-wide leads for example, end-of-life care, which is funded with health money, but they're employed by a voluntary sector organisation, but they work across and on behalf of the system, of the whole system in that role. So we're not being prescriptive, but we don't expect these roles to sit within creative or cultural organisations or teams. If they are part of the wider VCFSE sector, then we anticipate them being in organisations that have wider responsibilities for health and wellbeing, not specifically about creativity and culture. And in terms of recruiting to the roles, that will be for the employing organisation or partnership to determine. We're not going to specify that recruitment process as long as it's operating within the law clearly and be defended and they can justify that process. We're happy to support that recruitment process and be part of that if that's appropriate. And we will want people to share their recruitment processes with us so that we can signpost people to the opportunities that arise. But it will be for those organisations that are successful in this stage to decide how they want to recruit to these roles. So we thought it was helpful to list some examples of how roles might work, and these are examples only. They're not prescriptive, and we've had since then. I've had a conversation just last week with a particular system who had another scenario to suggest to us, which again would work. But we've given a few options here. So. The first is that creative health lead sits within an ICB or a public health team in a local authority, but is jointly appointed by the NHS and one or more local authorities. And we've got examples of joint appointments across other areas of responsibility in places. So that role would be sort of operating at place level, working across the health, social care and VCFSE sectors. They might have a particular focus on a particular theme, such as children's health or mental health or frailty and complex needs. And it would really demonstrate integration and shared ownership across the statutory and community system. So that's one example. Second example we've got is of neighbourhood level integration, where the creative health lead works within an integrated neighbourhood team, potentially spanning 2 or 3 integrated neighbourhood teams. And there they could be employed by the local authority, by a health organisation or a VCFSE partner. Again, in different places, we're seeing different organisations taking the lead on the development of the neighbourhood NHS. So the focus here will be on embedding creative health in those neighbourhood delivery models and supporting the sort of spread and adoption of practice and policy across neighbourhood teams and clusters. And we're particularly interested in hearing from these first phase neighbourhood health implementation sites, because this would really facilitate national learning and learning with NHS England. The third scenario we've suggested here is about the creative health lead being based within the ICB with a focus on integrating creative health into commissioning intentions for particular clinical pathways, for example, strong emphasis on health inequalities. We're not averse to the role having broader system responsibilities, but it would need to have at least 60-70% of its focus on creative health. But it might be that it's part of that has other responsibilities in that. And we have said that this could be filled by redeployment as part of ICB restructure. We know how challenging it is at the moment to be looking at bringing in new roles when, ICBs and providers indeed are in the midst of consultations on redundancies, etc. But for the right person, there could be an opportunity for a redeployment as part of this, but it would need to be a person who was passionate about this work and wanted to do this work. And the fourth scenario we've suggested here is an NHS provider or provider collaborative. So it might sit within, an NHS trust or a number of, or within a provider acting as employer on behalf of a collaborative. We expect this to be most likely in community providers where the expectation is that they assume more ICB responsibilities over time, and they especially have a role in terms of building partnerships in communities and reducing health inequalities. And for all these, there is a focus on seeing close working relationships with social care services, particularly where key areas of focus are, around children and young people, supporting individuals with complex needs, etc. So we are keen to see how these roles can work with social care as well. So we're anticipating this to be a competitive process. And here are the criteria by which we'll be assessing applications. So the more of these that you can match, the higher the application will score. And we've been having conversations with people about these since we've opened the programme. So we are looking for match funding, and if that's from NHS or public health budgets, that is good. That's what we want to see. Ideally, we want NHS or public health employment of the post holder. Again, we know that can be challenging, but that would be good to see. And if they're not going to be employed by an NHS organisation, we would expect to see some sort of management support for the post holder, so some link within an NHS organisation for that person, and an NHS email address, honorary contract, that type of thing, so that there is this sort of recognition that they are part of that system. If we haven't got a delivery budget as part of this, we are providing salary subsidy only. And there is one of the reasons for that is because we didn't want the focus particularly to be on this is about coming in and delivering a programme of creative health work in a falls prevention programme, for example. That's not really what this is about. But if an organisation or an application can bring some additional budget, some delivery budget to the work, that would be very welcome. We've asked for the post to be at least 2 years. Any commitment to a post beyond 2 years would be looked upon very favourably as well. Again, we recognise how challenging that is. What we recognise is that there are some systems who might find some of that easier than others, but we also want to make sure that there is a focus on health inequalities on areas of deprivation. So we will be looking at applications to look at how do they see this role addressing those priorities. We're looking at opportunities for integration with social care. And is there any infrastructure to support the role if there is already some sort of partnership group or committee or subgroup that exists or that they report to? That's helpful because we know therefore there's something in place to support the role. Excuse me. We want to support roles both in areas where work is not very well developed, as well as those where there is existing work but scope for further development. So what we're anticipating is that over the time of the programme, we will see a real diversity. We might see some areas where they feel well advanced with their creative health work, but this programme really adds to that and enables them to take it even further. But it's also about providing an opportunity to support new ways of working in systems that might be struggling in other ways. So some of the things that will be required, I keep coming back to the match funding, but it's really important. We will require match funding for the post for 2 years, and again, cannot be provided from arts or culture budgets. The post needs to be on an employment, not a freelance contract. It could be a secondment, And we think that is providing some flexibility for organisations that are not in position to recruit because of freezes on recruitment, but there may be secondment opportunities that they could facilitate. But it's not a freelance contract. It's not for a freelance consultant. We would like to see an NHS honorary contract, NHS email if not employed by the NHS. We haven't found that difficult in our associates programme. That generally seemed to work quite well, and it does give it, the NHS email address gives a level of access that is really welcome. So that would be something to be looking at if the person isn't employed in the NHS. We want the role to, or the application to come from partners. It must be supported by, it's not just for one organisation, it's ensuring some sort of cross-sector buy-in and sustainability. So we're not saying that all partners in a system have to be committed to this, but it is broader than just one organisation. So it's not about an NHS trust saying, oh, we'll have one in our organisation and it'll work for us just doing this. It's about how we get this working across the system. So some partnership support is needed. And then clearly support for the post holders' participation in the learning community, in the learning programme, and others to be engaged across the partnership in that system development programme. So who can and can't apply? So the programme is for health and care systems, and as such we would expect to see a health and care organisation as the lead applicant. Now it may be that the lead applicant is not NHS or local authority, it could be a VCFSE health and care partner, for example, but we do expect to see a public sector health and care partner as part of the application. And remember that NHS or public health employment and funding will score higher when we come to assessment. So it is for organisations to apply. It's not open to individuals to apply, nor to creative and cultural organisations, although they can, of course, be partners in the application if that's appropriate. But we wouldn't be expecting them to be the lead applicant for this. And I think just based on some of the questions that I've had since the first webinar and the discussions that we've had, it's also worth emphasising here that we are looking for these roles to be geographically spread across England. So although we're not saying we won't fund more than one role in a particular geographical area, we are encouraging, if we get inquiries from the same area, we are encouraging people to talk to each other and to think about how they might be able to make that work as one role, because particularly in these first few rounds, we're unlikely to fund two roles in a particular local city, for example, just because we're trying to get that spread. It may be that further down the line, when we can see how this is developing and we're finding that there are areas where there's complete cold spots and there's absolutely no interest and there's not going to be, there might be some opportunities. But I would encourage you, if you're thinking about applying, to you can make contact with us and we can let you know if anybody else from your area is interested and put you in contact with them, but contact other people that you're aware of in your local area to see whether you can get something going that is that meets everyone's needs. So we're nearly there. What to do if you're interested in this? Well, do talk to us at NCCH. Ask us any questions. There will be things that we haven't thought of. So we're really open to having discussions. I've had discussions with probably 20 systems since the webinar last. I'm happy to have another 20 conversations. So please do talk to us. Complete the application form. We've tried to keep it really simple with space for you to just tell us in free text how you would use the role. If there are any questions in there that you need clarification on, do get back to us. Don't let the form put you off. And it is a straightforward form. And I know that people offering funding always say that, but we do think it is. And we have tested it out with people. We've got a deadline of the 30th of January for the first round of applications. For 5 roles. We'll be interviewing shortlisted first round applicants online on the 17th of February, with decisions communicated by the end of that month at the latest. And there's then a second deadline of the 6th of March. And we expect that to be another 5 roles, and we expect to communicate on that by the end of March. We'll confirm the detailed timetable as soon as we're able. We are just waiting for a couple of things to be formally, officially signed off. And as I indicated earlier, we expect to announce further application rounds during 2026 and 27. So we're also keen to hear from systems who think that they might be interested in applying, but not yet. There is an expression of interest form which can be submitted anytime and which can form the basis of an application. You're not required to submit an expression of interest form, but you can do that. It will help us to just see who might be coming down the line. But do contact us to discuss the programme at any time and to think about those timings. I've had a few questions just recently around, is it going to be easier or harder as we move through the programme? I don't know. I suspect it will become more competitive as we get through the programme because there will be more systems who are in a position to make an application. And we realise that this has been quite a tight deadline for this first round. It is to some extent dictated by some of the requirements of the funding. But the important thing is to make sure that it's right for you. So yeah, but do discuss it with us at any time, and I'm around for the next couple of weeks if people are wanting to get something in by the end of the month and need to have a conversation before then. So I think that's it from me. There's a lot to get through there, but I'm trying to leave some room for questions. If you want to get in touch, do contact me via email, which is on there. You'll also find that on the website. Very happy to take questions. I think Alexis will try and pull those together. If we can't answer the questions today, either because we need to consult with the funders or we need time to think about your question, then we will get back to you and we will be putting responses on our webpage as well. So I think that's it. We will send out the slide deck and the recording to everyone who's registered here today. And that will also be available online. So I'm going to stop sharing now. Thank you for coming, and I do hope we see some applications from your systems. And I'm going to stop and see whether Alexis has got any. We had any questions?
Hi, Jane. Thank you for explaining all that, Jane, for us. So I'm just going to go, I'm going to try and collect some of the questions together if they're around the same kind of theme. So Juliet asked, it sounds like the funding is anticipated to cover an ICB footprint, region, sub-region. Could we focus an application on a specific geography, i.e. an local authority boundary?
Yes, absolutely. I say when we first started talking about this, we were thinking that this would be an ICB footprint. That has changed because the ICB footprints have changed. We've got some quite large ICBs now, so definitely we're open to that geography. I think the important thing to think about is where are the opportunities for influence. So, but a local authority area is definitely, a geography that we would be happy to look at. We're no longer wedded to the ICB footprint. As I say, some of those are now quite huge, so it may not be so appropriate.
So in addition to that, Jane, someone's asked, when you say systems, do you mean borough-based?
Not necessarily. I mean, in systems, it's a bit of jargon, isn't it? It's a bit of shorthand. It's about the health and care organisations that work together, and we anticipate in that, we expect different NHS organisations to be part of that. So we've got our provider trusts, our ICBs, primary care networks. Then we've got local authority involvement in that through public health, social care, children's services, and then those BCFSE organisations that are part of it. So it's part of a system that's working together. The important thing is, I say, that the applicant, we'd expect the lead applicant to be, if not public sector, to be really working very, very closely with the public sector. This is about trying to influence that bit of the system. A borough, we know that boroughs are, or a number of boroughs are going to be applying, for example.
Great, thanks, Jane. And this kind of relates to that kind of whole looking across the system, this question. So Joanne has asked, how does the role work across the whole system where there might be varying priorities, timeframes, etc.? Is there a suggested space learning for taking a whole system approach for a single role working across a whole system. They've given an example in East Sussex. We're currently 2-tier LA, 6 organisations, local authority, as well as ICB, ICTs, primary care networks, and multiple providers covering a large population. How is a joined up approach supported? We have a Culture East Sussex board, a bit unclear if local NHS commissioners and providers are part of this.
Yeah, so that's what I mean. It will depend on very much on local context and on how the partners that are coming together to make the application see that. So for example, I've had a question from another part of the country, which was about a number of boroughs that are working together as a place, but in fact they do have very different priorities in there. And the question was, could we just focus on one of those boroughs in the first year, and then maybe move to a second borough in the second year, and then share that learning more widely? And the answer is yes, you can do that. We've had a question about if this is working with a neighbourhood team. We've got 4 neighbourhood teams in our ICB patch, but we really only want to focus on one. But it is a system-wide role. It's like, okay, think about how that, is this about you sharing the time out between the 4 neighbourhoods, or is it about saying we're going to focus on one neighbourhood and share the learning from that into others? So it will depend. It will be different in different places. The important thing is that whoever's put in the application, the partners put in the application, have an agreement about how that is going to work and what they think those priorities should be.
Great, Jane. And as Jane has already said, if there's any kind of bespoke questions around those kind of complexities of your kind of system and working across it, feel free to email Jane and she can help you with that more bespoke side of it as well, just to give you some pointers. So we'll go on to, Jane, if you don't mind, funding. So there's a few questions about funding. One from Laura was, is there any extra funding to take into account inner and outer London waiting costs?
Yes, I should have said that. Sorry, we've put in the funding that we've indicated there is non-London waiting, but we have factored in the need to support the inner and outer London waiting. So great. Yes.
Thank you. Another one is, could match funding be from a current existing role that links directly with the role requirements already? So can the match funding be coming from something that's being already paid for?
So because it's actually got to be money that pays the salary of this new role. So that will be difficult, if you see what I mean, unless, so we did have a question last time about, could it be a role that goes from being a part-time role to a full-time role? It's possible. We'd really want to see how it's going to be different. It's not just, oh, we're just going to have a couple more days of this person doing what they're doing now. It is about how does it, how does it really take things forward within the system. But the key thing is that it's not about match funding in kind, because it does require actual cash to support the salary of a person. Does that answer the question?
Right. Yes. Thanks, Jane. And this is kind of on a similar vein. So Rachel, who posed this question, might feel like it's already been kind of answered from Jane's response there. But how would you view allocating some hours from a substantial post as the match funding? So a similar kind of thing. But as you said, Jane, if it's like going from part-time to full-time, that would be possible.
I mean, we'd look at it. It wouldn't be, I don't think it would be the strongest, if I'm honest, unless it was, you were able to demonstrate this was part of a bigger picture about growing creative health and you had, and what were the ambitions and what were the steps to achieve the ambitions for a team of people, for example. I mean, ideally, we'd love to see a team in each whatever ICB or system, but we know that's going to take a long time to achieve. So, the key thing is, if this is if we're getting, if we're wanting to see 4 more days of work of somebody at a band 7 level in creative health. So you'd have to think about how that would work. An existing role, you could probably only allocate a couple of days to this, and then you'd have to think about, just what else would they be doing if not this, if you see what I mean?
Great, thank you, Jane. So I'll go on to kind of timelines now, because there's a few questions about timelines. So we've got one which asks, by when would you need to have the match funding agreed? This is a particular challenge given the reduction in budgets and restructures.
Yeah, we know. So we want to see in your application, we would want you to indicate that you've identified where the match funding is coming from. It depends if it doesn't have to be in this if you were going for the January deadline, for example, you wouldn't necessarily have to find funding that's in this financial year. It could be next financial year, or it could be this financial year, but you're wanting to spread it into next year because of whatever reason. So we do need to see that funding has been identified at the point of the application. We do need to see that is there. How it gets spent, and if there's space in there to describe any limitations or constraints around when money needs to be spent by, or when it can't be spent until, if you see what I mean. But we do need to have that match funding identified at the application stage. If you're not at that point, but you really want to get your expression of interest in, then you can do that and give us an indication of where you're at with funding, and then we can sort of start to program that in. But we do need that match funding identified when the application is made, because we do ask a question about where it's coming from.
Right, thanks, Jane. And this kind of leads on from that question. Caroline asked, in my borough, the INT is in the early stages of development, but it feels like it'd be brilliantly paced here. Of course, this means that timelines for them are unclear, but there is a specific date that NCCH expects to have the leads in employment.
No. I mean, we know that these things will take time to, to recruit to. So once we've given once we've made the selection of the applicant and notified them about that, we'd expect the process to start. We wouldn't want to see a massive delay in that, but we know that these processes take some time. And again, that's maybe something that if someone's shortlisted, we can have that conversation at that point, interview about what's the likely time frame for somebody to be recruited. We know that it will take, if someone's recruiting straight from scratch, and someone's, they appoint somebody who's then got to give notice on another job or whatever, it could be 3 months or more before someone takes that post. It's more around the commitment to having that post and getting going with the recruitment that we would want to see.
Right, thanks, Jane. And that kind of leads on to the next question that Nick has asked. So obviously there's a deadline coming up now, but do you know roughly when the following round application windows will be?
It's difficult to say at the moment. So the next round is 6th of March. We've given a deadline for that one. I expect, but don't hold me to it, but I expect we might have a June application round. And then possibly either June or September. We wouldn't be doing one over the summer because we know how difficult that is. And then probably another one, I would think, in March next year, and then maybe June the following year as well. That's the sort of timing I'm thinking. But I think if what we're aiming for is March for the second round, and then a third round in June, if we can get it's literally just about the detail of getting things officially signed off in time in different financial years that is challenging. So it's not about people not being committed to the programme, but more around just the those of you who are working in finance will know the ins and outs of when we can actually release funding.
And I think that's something just to add, isn't it, Jane, that if someone is interested, so Nick, if you're interested from your system, I think just get in touch with Jane, and then Jane can update those who are interested in putting that expression of interest in at the date that kind of suits you. So Jane, once she knows, will kind of let everyone know who's interested in actually expressing an interest in it.
There's just another point I've just thought about, Alexis, as well, which I probably ought to add to, because I think this came up as one of the FAQs. But if we're not able to, so say we have 15 applications for this first round, and we can only fund 5 of them. If we've got really strong applications in there that we want to take through to the next round, then we won't expect you to do a new application. We would go back and say, weren't able to fund you this time because we had stronger applications, but do you want this to be considered for the next round as is, or is there anything you want to update? If the applications, if we think the applications aren't particularly strong or could be strengthened, we would let you know about that as well. So you're not just sitting there waiting and, you know, not getting any feedback. So we will give feedback to those that we think could be strengthened. But if we've got applications that we think, you know, if we were able to fund 10 roles this time, we'd have funded this one of these, we would let you know, so it could just roll into the next round. So you're not having to do extra work.
Great, thanks, Jane. It is about just connecting with us if you are wanting to put an expression of interest in, and kind of, you know, we can help you with that. So I've got a question from Sally. The National Art in Hospitals regional group that they're part of has been asked if a consortium application could be submitted from NHS trust across a region. Would that be possible?
That's not something that we'd thought about. So I think we'd need to look at what the role was doing, thinking about that role. I think we'd expect to see a role there that has a wider, like I said earlier, that is wider than just working with trusts or working with hospitals particularly. I know that the arts hospital managers don't just work in hospitals, but I'm just wanting to make that point that it does need to be a more system-wide thing. But I think talk to us about it if you're interested in that, about what you're thinking, and we can reflect on that and yeah, see where it sits. And I think it's a sort of question we might need to go back to our funders on, but yeah.
So Sally, if the consortium on behalf of the non-group wants to get in touch, just get in touch with Jane, and then we can kind of go back and ask that question, no problem at all.
Yeah.
And then the last question we have currently is from Steph, and it's around that it just came in just a minute ago, and it's around kind of allocation of time, I guess, again. So Steph asked, can the role be split into 2 part-time roles, i.e. 2 times 2 days a week roles rather than a 4-day-a-week role? So 2 people taking that role on rather than 1 person.
Yeah, I don't think we have strong views about that. I mean, I think it would be good to try and describe that as a job share, even if the responsibilities, you know, are separated out, as you know, in that it would be good to describe it in that way. But I don't think we'd have an issue with that. If they were working, you know, I say the job share element is about them working as one and understanding it rather than 2 completely separate roles. They'd need to be sort of joining up, but yeah, I don't think that will be an issue.
Great, thank you, Jane. That's currently all the questions that everyone put in the Q&A. So unless any of those who we've answered the questions have extra questions, then feel free to pop that back in or pop it in the chat. But that is the Q&A questions finished.
I just think the other thing I'll add, because again, this has come up. So I've had systems saying, oh, what if we want to employ a full-time role, which would be great, because we've calculated that subsidy on the basis of, say, a 4-day-a-week role. If you wanted to recruit to a full-time role, we couldn't provide any more money in terms of that subsidy. So if you were able to bring that additional funding in, that's fine, but we'd be happy with that. Similarly, we've been asked if we appointed to a 3-day-a-week role, what would that mean? And we would reduce the subsidy to 50% of the 3-day-a-week role if that was the case. So we haven't got the capacity to expand it into a full-time role. But it wouldn't really feel right to offer that £25,000 on the basis of a 3-day-a-week role. So, but yeah, there are different options in there.
Great, thank you, Jane. So I think unless there's any more questions from anyone, which you're welcome to put in the Q&A or the chat, what we'll also do with all the questions we had today, which was slightly different from the questions we had in the first session, is collate them into an FAQ with the others questions that we've had before, so it's really easy for people to read. But as we were saying, if anyone has any questions about their system or the footprints or the kind of logistics, feel free to email Jane if you're thinking about putting an expression of interest in, and like we said, Nick, about the timelines as well, if you want to kind of be updated in a couple of months' time. So feel free to give us a shout as well. Yeah, so if anyone got any last minute questions, you can put them in the chat if you really want to. Don't worry about the Q&A so much. If not, then I'll leave it to Jane to say goodbye.
Thank you very much. Thank you all for coming. We've been really heartened by the interest in this because we know this is a really challenging time. And what's been great is to see how people are really thinking, creatively and imaginatively about how these roles can really help in this system. So thank you all very much for coming. And yeah, as Alexis says, please do get in touch if there's anything you want to talk about, any other questions that you have. And I look forward to hearing from some of you.